Good evening. My name is Jared Powell, and today we'll be learning about heart disease in women. Let's get started. Assessment questions. These are the questions that will be addressed throughout the period of this presentation. They are: what is the problem? Who does the problem affect? When the person became affected? Why the person was affected? How this person became affected? What is the association with the problem for the person affected? What actions should be taken for this problem? What approach should be taken to aid in the solution of this problem? Heart disease in women. Heart disease is the #1 killer of women. Heart disease causes 1 in 3 deaths each year. Heart disease is not curable, but it is preventable. Factors such as blood pressure, cholesterol levels, smoking status, inactive lifestyle, social lifestyle, and more. Lifestyle changes could reduce the risk of heart disease in women. Symptoms of heart disease or heart attack on women are lightheadedness, pain, discomfort or numbness in the arms, back, jaws, neck, and between the shoulders, pain, pressure, fullness or squeezing of the chest that could last more than a few minutes or comes and goes, cold sweat of the skin, trouble breathing, or shortness of breath in the lungs, upset stomach, or urge to throw up, possible feelings of tiredness in some cases, days or weeks before a heart attack occurs. Women may have heartburn, a cough, heart flutters, or loss of appetite. To reduce the chances of getting heart disease or heart attack, one could know your blood pressure, talk to your doctor about being tested for diabetes. If you are a smoker, you should quit smoking. Schedule an appointment to have your cholesterol and triglycerides checked. Make healthier food choices. Obesity and overweight increases the risk for heart disease. Reduce your stress level and discover alternative healthy ways to deal with stress. And limit your alcohol intake per day. Women with congenital heart disease are at a lower risk for heart-related complications when they give birth. Average annual CVD deaths on women 35 years and older per 100,000 between the year 2000 to 2006 in the U.S. is 428. Black woman is 566. White woman is 419, and Hispanic woman is 332. Policy development actions. What has been done in general to address the issue? Resources, facilities, organizations. There are organizations and foundations that provide educational classes and hold seminars to educate women on the risk and symptoms of heart disease. Within these seminars and classes, the women are equipped with tools and resources that allow them to identify the signs associated with heart disease. Some of the organizations and foundations that are found now are Women's Heart and the American Heart Association, Heart.org. What has been done specifically in the community, city, town, state your team is researching to address this issue? All over the world, in local communities, cities, towns, and states, people will wear ribbons and participate in walking marathons. This is even observed within the school systems. Locally, there are health fairs held to bring awareness to illness that affect all people, but may have a larger effect on those that reside in lower income areas. Policy development actions continued. Existing policies. What policies currently exist to resolve this issue? Currently, the one policy that is in place is the ACA. With the Affordable Care Act, this makes sure that all people have affordable health care insurance that would allow for them to be able to go and get the proper care to treat an illness or to head off an illness. Heart disease is an illness that has a long-lasting effect, like many others, so it is important to upkeep the policies in place. Policy development. What new policies should or could be developed to better address the issue? With Heart.org, some of the policies that they are trying to get in place and keep in place are: apply a key provision of the Heart for Women Act and require the FDA to report on how new prescription drugs and medical devices work in women and minorities. Maintain funding for Wise Women and CDC, which is the Center of Disease Control, prevention programs that provide cardiovascular screening and lifestyle intervention services to low-income, uninsured, and underinsured women. Protect funding for National Institutes of Health research to better understand how heart disease and other forms of CVD affect women differently, increase the percentage of women who participate in clinical research, preserve Medicare and Medicaid, both of which disproportionately serve women, strengthen the percentage of women with access to affordable health insurance coverage, through support of the Affordable Care Act, provisions that ban the discriminatory practice of charging women higher insurance premiums than men, increase access to cardiac rehabilitation, report healthcare quality measures by gender, race, ethnicity, primary language, and disability status, support the Health Equality and Accountability Act, which helps eliminate health inequalities among minorities, women, and other groups, identify stakeholders and potential facilitators, are there leaders and/or organizations within the community that can be identified and assist with the policy development. Who are they, and why did you specifically select them? For the most part, we are all stakeholders in the fight and implementation on heart disease in women. However, the facilitators would be the American Heart Association and Heart.org. Both of these facilities can be influential in the policy development process. Make sure you explain how 3 essential services that fall into the policy development category are applied to your health problem. Inform, educate, and empower. Mobilize community partnership, and develop policies. The 3 essential services that fall within the policy development are applied to heart disease in women because they conduct research on the issue that is at hand. Once information is gathered, they relay this to all the people that may have the power and resources to make something happen. Once the information is passed along, the public can be educated on the issue at hand, and then they can empower the community about the issue and work on a solution together. Assurance section. Enforce laws and regulations that protect health and ensure safety. Prevention is the key in order to help reduce the risk of heart attacks in women. In order for society to be successful in prevention, it would be wise for women to get checked for heart attack symptoms and talk about the risk of heart disease at their annual doctor's checkup. For too long has heart disease been seen as a man's disease, and it is time that women all over the world are aware of their risk as well. Laws should be enforced that every female doctor makes sure to consult with their patient on ways to reduce the risk of heart attack, as well as behavior that increases risk of heart attack in women. Link people to needed personal health services, and assure the provision of health when otherwise unavailable. There are many free women health clinics that are available to the vulnerable population, such as those who are poverty-stricken or not insured. These women's clinics may not have services directly related to heart disease in women, but they might be able to point them in the right direction. In order to combat the epidemic of women's heart disease, the first step is awareness, and if these women's clinics were able to jump on board and offer screening and educational material, it would greatly help in the awareness and prevention of heart disease in women. Assure competent public and personal health care workforce. Like any other aspect of healthcare, a policy must be enforced in order to ensure the proper information is given out to every patient and the appropriate tests are done every time. For any new policy to thrive, it must be available to every patient that walks through the door, and the doctors must be held personally accountable for making this information readily available to all patients. Evaluate effectiveness, accessibility, and quality of personal and population-based health services. The effectiveness of this problem lies within the providers and the individual women who receive the information. Women have access to many services that could greatly benefit and help improve their health. We cannot force women to use these services, but they are readily available for when they are ready. If the providers are very passionate about what they do, it helps make women want to go to take accountability for their own health. Advocates for women's health have helped increase the number of aware women for disease, such as heart attack, which once was only solely seen as a male disease. And these are the references associated with this presentation. Alright, thank you for joining us. Once again, my name is Jared Powell, and I hope you learned something today.